Hey, Namaste everyone. I'm Dr. Karan, Karan from California. In this video, I'm going to talk about why checking blood sugar after meals is crucial. Understanding insulin adjustment. So if you or your loved ones have diabetes, you probably check your blood sugar before meals. But did you know that checking your blood sugar 2 hours after eating is equally important? And today I'm going to explain why that number matters, how it guides your insulin dosing, and how it helps you get better long-term control. Okay? So why check 2 hours after a meal? When you eat, your body digests carbohydrate, protein and other stuff, but mainly carbohydrate we are talking here because it turns into glucose, right? And when it enters your bloodstream, your pancreas reacts to it, or your insulin injection is supposed to bring it back down to normal level. So the 2 hour post meal check tells you how well that process worked. So if your blood sugar 2 hours after eating is below 180 milligram per deciliter, that's the number you get, it means your insulin or body handled that meal very well. If it's above 180, your body is struggling to process that glucose. Maybe the meal had too many carbs, or maybe the insulin dose wasn't enough. If it drops too low, less than 90, you likely got too much insulin, or you skipped your carbs in your food, or you change your meal, so that's affecting it. So how post-meal sugar guides your short-acting insulin? This is really important for people who take pre-meal insulin. So I wanted to touch that, and it's so important. So rapid-acting insulin or short-acting insulin is Humalog or Novolog, or there are some different kinds by different name in different parts of the world. They're designed to work right after meals. So your 2 hour reading shows if the previous dose was correct. But short-acting insulin, they works within 15-20 minutes, maybe half an hour. It lasts for 4 hours, which is the duration of your blood sugar peaking up in 2 hours, then dropping down in another 2 hours. So basically it's 4 hours time. The time you take to eat your food, it goes in the bloodstream and comes down. So if your 2 hour sugar keeps going above 180, so it means that you need to increase your mealtime insulin slightly, okay? And usually it's about 2 units per 50 milligram per deciliter of glucose difference. If it goes below 90, that means you need to reduce your pre-meal insulin. So that's why it's important. And as far as how post-meal sugar affects long-acting insulin, like Lantus, Basaglar, other different kinds like a Tresiba, right? So we're talking about your basal insulin, your background insulin, which works to keep the blood sugar, within normal range when you're not eating, right? So in between meals. So long-acting basal insulin works quietly in the background throughout the day and night. And if all your post-meal sugars are running high, despite adjusting short-acting dose, it means your basal insulin is too low. Your background coverage is weak, so you need to go up on your background coverage. In that case, your doctor may need to increase your long-acting insulin by several units every few days until both fasting and post-meal sugar stabilizes, right? So that's how it's important as well for correction of your long-acting insulin. So it's that 2-hour post-meal blood sugar number is extremely important to make adjustment in pre-meal insulin and your basal long-acting insulin. So here's the complete picture, complete glucose picture. Fasting sugar shows you overnight and basal control. Pre-meal sugar sets your starting point for the next meal, and 2-hour post-meal sugar shows how your insulin and food matched up. So, thing is that if you are doing it correctly and you're adjusting it correctly, you're eating it correctly and making adjustment in insulin, your A1C will be close to 7, below 7. So remember, checking blood sugar isn't about numbers. It's about learning your body's rhythm, learning what you eat every day and how it's affecting your blood sugar fluctuation. The blood sugar variability is extremely important. It just cannot vary too much. It cannot just be too up and down. So 2-hour reading tells the story how well your insulin, food, and your body are working together. So keep tracking, stay disciplined, and you will see great result. So so fasting blood sugar it tells you overnight control, okay? And that means it will affect your fasting level is running high. That means your basal insulin, longer acting insulin needs to be corrected. Pre-meal, your blood sugar tells you a starting point of your blood sugar before meal, and it will determine your short acting insulin dosing. 2-hour post meal, it shows the effectiveness of meal insulin, and the number will determine how much adjustment you need for short acting insulin, and also sometimes helps you to make adjustment in basal insulin. Okay, so thank you for watching this video. I'm going to have several videos about different treatment, the insulins and their dosing and the schedule and how meal is affecting. They're the basic stuff I want my followers to know, because the more you know about it, better you're gonna do it, because knowledge is powerful. And once you know how it's working and it's not working, and there got to be a good synchronization into your eating habit, your activity, and kind of meal you're eating. And variability of blood sugar is very important, because body is trying to bring everything in balance. So there's a less fluctuation, less up and down, too much, better is for your body. I'm going to talk about how variability can cause chronic damage to different parts of your body, even if your A1C is staying within normal range. So I'm going to have several videos for you guys. So watch out and keep watching my videos, and then I have tons of information. It's going to be curated for diabetic patient for next few weeks. So that's what I'm going to focus on. So thank you for being there. Thank you for watching. And I appreciate very much. And thank you for making comments and staying in touch.